everyone, I'm Dr. Pranjal Jain, and today we are back with another episode of concising and compiling stuff for your NEET PG exam. Topic for today is scores and classifications from all over your surgery. Let's start. First, the scores in trauma. We just need to know the components here and we'll derive them from the name itself. Let's see how. First, QSOFA or revised trauma score. Both of them have the same components, that is R, T and S. R for respiratory rate, T for trauma and S for shock. What do we measure in shock? BP. What is the most common trauma score? Glasgow Coma score, right? So QSOFA score, you remember respiratory rate, GCS and BP, three components. Next, TRIS. TRIS sounds like an extension of ISS only, so it is an arm of ISS and that is what its components are. That is ISS का arm है ये, ISS arm. ISS score as it is followed by arm, that is age, the RTS score as above and mechanism of injury. Okay, ISS now ISS score, here we don't even need to learn the components, we just need to know what is it used for. It is used in cases of polytrauma and MES. The components here are ELISA, that is energy, limb ischemia, shock and H. For both ISS as well as MES, we have an important number to remember, that is more than 6, which means if ISS score is more than 6, the patient cannot survive. But if MES score is more than 6, that means we need to amputate the limb here. Let's write this down clearly. QSOFA RTS. TRIS is ISS arm. ISS is for polytrauma, MES is ELISA, and both of them more than 6 is an important indication. Okay. Now moving on to the most important trauma score, that is your Glasgow Coma score. Here we have three components: eyes, speech and motor. Now for all of them, 1 means there is no effect, no eyes opening, no speech and no motor movement. And the highest score in each of them is doing that activity spontaneously. So 4 in eyes means spontaneously opening the eyes. 6 in motor means spontaneously moving the limbs. And 5 in speech means spontaneously talking to you. Okay. After that, it is just in an increasing order. See, for eyes, 1 means no opening of eyes. 2 is opening to pain. 3 is opening to voice and 4 is spontaneous. Speech. Speech and motor, I was often confused in what lies here, so I used a mnemonic here. It's your wish if you want to remember this or not. In speech, I used the college SRC. It's a very famous college in Delhi, SRC. So S is inappropriate sounds, R is inappropriate response or inappropriate words, and C is confused. So SRC College for speech, sound, response, confusion. For motor, we remember EFWL. There was a scheme long back about schools and colleges which was called something like ESWL. So here we remember EFWL, which means extension, flexion, withdrawal and localization. So I hope Glasgow Coma score is clear with this. 1 for all is no movement, then increasing order. To paint, to voice, spontaneous. Speech may we remember SRC, and motor we remember EFWL. Let's write this down clearly. Take a screenshot, teach it to a friend, and you'll remember it. Moving on to surgical infections. Here we have three important criteria: asepsis score, Southampton score, and SIRS. First, सबसे simple, SIRS or SIRS score. Who will call you sir? The Englishmen. So if you go on a white trip, that is, you go on a trip to US or any white country, they will call you sir. What is white trip? WBCs, temperature, respiratory rate, and pulse. As simple as that. Then asepsis and Southampton score. Asepsis, the name itself tells. A, additional treatment. S, serous discharge, erythema, purulent discharge, separation of tissues, isolation of bacteria, and hospital stay. Southampton is a very similar score. We just take these four from here and place it in Southampton in the correct order. That means ESPS rather than SEPS. What that means is stage 0 is normal, stage 1 is mild bruising, stage 2 would be erythema, then 3 would be serous discharge, 4 would be purulent discharge, and 5 would be separation of tissues. So asepsis, Southampton, you just need to remember the SEPS. And for SIRS, you know, white trip. Now the liver scores, and probably the most commonly asked score. Let's study these. First, the MELD score, which is slightly different from child pug and PELD. MELD is basically modified end stage liver disease. MELD sounds like medal, and who will get a medal? The CBI, right? So MELD के components are CBI, creatinine, bilirubin, INR. Now child pug score. How do children talk? They say ये मेरा भाई है, ये मेरा भाई है, right? So भाई for child pug. What does it stand for? B for bilirubin, hepatic NCAF, albumin, ascites, and INR. Remember it in this order only because our PELD score has three components directly from child pug. That is bilirubin, albumin, and INR. So for PELD you remember BAGI. B same, A same, I same. Apart from that, the other A stands for age and G stands for growth. Let's write this clearly. Child pug, bhai, three of them taken, bagi, and medal किसको मिला? CBI को. Let's study child pug in a little more detail. Your bhai components are written here and we give 1, 2, 3 score. सबसे simple for hepatic encephalitis and ascites. It is just none, mild to moderate, severe. None, moderate, severe. None, moderate, severe. For the other three, we need to remember values, and for easy purposes, just remember the values as 2 to 3. So 1 would be less than 2, 3 would be more than 3. 2 to 3, less than 2, more than 3. 2 to 3. Now albumin, here there is a slight glitch. If albumin is more than 3, it is a good thing, but if albumin is less than 2, it is a bad thing. तो यहाँ पे हमने 2 to 3 का spectrum change कर दिया है. But मोटा मोटे you need to remember the values are 2 to 3. Let's study the exact values. 2 to 3 more than 3. none, mild to moderate severe. Albumin. Now, the more the albumin, the better it is for the body. So, more than 3.5 has a score of 1, but less than 2.8 has a score of 3. Now, ascites, none, mild to moderate severe, and INR again ranging from 2 to 3. Less INR score 1, more INR score 3. I hope this makes sense. Bhai, the second and fourth one is just mild, moderate, severe, and the rest 3 values is 2 to 3. Last part are the GIT scores. There are not a lot of scores in GIT, so just glance at these 3 ones and I think you're sorted after that. So Forest classification, what is it used for? Peptic ulcer disease, Alvarado, appendicitis, and Hinchey classification, it's for peritonitis. Okay, so starting off with Forest classification. Here just remember A, B, C, that is active bleed is stage 1. Just blood, if you see, there is no active bleeding per se, there is only blood. It is stage 2, and a clean ulcer base is stage 3. So the details are 1A, 1B, spurting bleed, oozing bleed. Both of them are active bleeding. A is proper spurts, B is slight oozing. Class 2 is you can only see blood, no active bleeding per se. So non-bleeding visible vessel, adherent clot, and flat spot in an ulcer. 3 is the clean ulcer. ABC. Okay. Alvarado score is for appendix, and the mnemonic here is the famous Mantrals. See this one and you are sorted. Just remember, tenderness in the right quadrant and leukocytosis have 2 points each. Last, the Hinchey classification. It is in order of severity. That is, earlier a localized abscess, then distant abscess, then purulent peritonitis, and feculent peritonitis. So with that, we come to the end of all scores and classifications in surgery. I hope you like this video. I will be making a separate video for all cancer classifications, which would also include gynae classifications. So don't forget to subscribe. Thank you.